Hi guys, welcome back to another episode of Wellness Online with Dr. Shali. I'm privileged to be able to introduce you to my gorgeous friend Naslina.
Hello everyone.
She's a mother of 4 and I'm happy to see her, that's why we're smiling, but we are in the hospital right now because her daughters actually, both of them were admitted for dengue. Yeah, so how long have you been here?
Almost 4 days.
4 days. So a little bit about dengue fever is it's caused by the dengue virus and transmitted by the Aedes mosquito. So you have unfortunately had to have 2 admissions.
Yep.
And last year, was it?
Last year, yeah. During Raya actually. I think last 2 years.
Last 2 years, your other 2.
Other 2, yeah, that's right.
So now all 4 have been admitted for dengue.
Yes.
So I wanted to concentrate on the stresses and worries that parents have or a mother would have when their children are admitted. So do you think this time around the dengue worry is more, or because you've had 2 children admitted before, you're a bit more prepared this time?
Yeah, this time around I am more prepared because I had experience with my other 2. So I am more focused, I am more calm this time, and I know what are the symptoms to look out for example like fever. So the moment when my son had fever, so it was like 3 days fever, and I checked, like there's no sore throat.
So how about this time around, what were the symptoms that you saw with Zara and Sophia?
So this time around I would say it's similar. And things that you should look out for is also when there's fever, there's no cough, there's no flu, and they keep on complaining headaches, and that was before fever actually. So one of them complaining about they have joint pains, and I started to suspect, when one of them said that they don't have appetite. So I quickly get them to check their blood, and it was tested positive dengue.
So you came to the hospital straight away?
Yep. I think because the clinic has referred us to the hospital just to confirm whether they are admitted. I mean, they should be admitted, and they should be admitted for dengue.
Okay. So what is your biggest worry when your child contracts dengue?
I mean, as a mother, my biggest worry or concern is they would develop very bad dengue, because I understand that the serious cases are pretty bad.
Yeah, that's correct. So basically you're worried about complications
Yes,
of the
that's right.
dengue.
Yeah.
So did you see any complications with the first admission for your other 2?
There's no complication, but I would say for my son, Hassan, he couldn't walk because he complained that he has knee pain. So at that point of time, there's no fever, and right after he complained about the pain, the following day he had fever. So because of that, we have to bring him to the clinic, the nearest clinic, and we check his blood, and he was then tested for dengue, and we got him admitted.
So yeah, the biggest worry, I think, biggest complication for dengue that we're worried about is bleeding, isn't it?
Yep,
so
that's right. Yeah.
as I'm sure you know, they monitor the platelet count. So what was the lowest of all 4 of your children?
I can't remember exactly how low the platelet count 2 years ago for Hassan and Khatijah, but Sophia had around 138, which was the lowest this time.
So yeah, usually the normal platelet count is 150 to 400, so it will drop below 150, and we have to monitor very closely once it goes below 100. And they can go as low as 20. In the hospital, when we see that, we would transfuse. And so you now recognize what to look for in dengue hemorrhagic fever.
Yep, that's right. And also the doctor informed me to look out for blood in their stool, and check if they have stomach pain.
So yeah, in case there's intra-abdominal bleeding.
Yeah, that's right. And also don't worry when your child has no appetite. Just make sure that they are well hydrated, and the fever would take around 5 to 7 days. And once when the fever subside, then only they would have appetite to eat. Yep.
Okay. So I am very, very sorry that we had to meet here under these circumstances, but
okay.
Thank you so much for giving us all this information, and I think it would benefit a lot of mothers out there or parents out there who are worried about their children contracting dengue, what to look out for, and basically, because this is a wellness blog, how to deal with the stress and anxiety of being in your situation right now. Like I said, not many people have all 4 children who have been admitted for dengue, so
right, yeah.
you are the right mother to come to for advice. So thank you very much, and
you're welcome.
And good luck to Zara, because Sophia's okay now, isn't she?
Yep.
She's at home, and we wish her a speedy recovery, and hoping that she can go back to 100% in a few days.
Yeah.
Okay?
Thank you so much. Yeah.
Be strong.
Thank you.
Anything, I'm here for you.
All right. Thanks, Shirley.